Hey folks, another episode of the Appalachian Roundup here. Another research note. What they're trying to understand, what do moms think about grandparents giving their kids sugary foods? That's basically what they're trying to figure out. To answer this, they went and talked to 66 different women from West Virginia and 60 different women from Pittsburgh, but all of these women were mothers of kids aged 2 to 5. After they interviewed the different women, they came to the conclusion that the women's perspectives filled into 4 different categories. The first category, some women saw the sweets as a grandparent's privilege. Granny and grandpa can give sugar because they're granny and grandpa. Another group of women saw the sweets as basically the grandparents' responsibility. That often boils down to babysitting or watching the kids. Because they're babysitting and watching the kids, they get to decide what the kids eat. Another group of women see granny and grandpa giving sweets to the kids as basically a way of showing care and affection. This last group of women said, or they perceived granny and grandpa giving sweets to kids as something they did because granny and grandpa didn't understand that the sweets would make the kids have cavities. The researchers conclude one of the main drivers of cavities in Appalachia is granny and grandpa basically giving kids sweets, and that there needs to be some kind of what they describe as a social intervention to teach granny and grandpa that sweets cause cavities. This strikes me immediately as bullshit, as kind of copping out and missing the bigger picture about what's going on and why kids in Appalachia have cavities at disproportionate numbers. The real issue for why kids in Appalachia disproportionately have cavities compared to other kids in the United States boils down to 4 things, okay? And in no particular order, it's this. Much of rural Appalachia is a food desert, okay? That means that there are no places to buy fresh food and vegetables, non-processed foods nearby most people. Okay, so if there's no place to buy good food, then generally people will eat at the local community store or whatever, and that's what I did a lot of times. And this meant eating things like getting a Snickers bar, getting ice cream, processed foods that are sweet and not so good for your teeth. The second matter is cost. Look, so let's say you did make it across the mountain over there to the food shitty. Fresh fruit and vegetables are more expensive, and so cost really factors into why people have cavities. Third, one of the points that they make in the research, moms say that grandparents are responsible for the food. I mean, this itself is something that the research doesn't really address, which is the bigger issue of how many grandparents babysit or effectively raise kids in Appalachia, because number one, either the mom and dad are out working. Number two, fairly sizable chunk of the population of Appalachia where moms and dads are drug addicts, honestly. They're either meth heads or opioid addicts or whatever it happens to be, but they're unable or unwilling to care for their kids. Grandparents a lot of times step in to care for kids, and grandparents are working on a fixed income. It's often limited. They're living in food deserts a lot of times, so you get the picture. So it's like easily available, accessible, quality food that contributes to things like cavity and obesity. The fourth point, there's no public health care, certainly no public dental health care in the United States. And so what this means is, if you grow up in a place where there is actually a dentist available, I didn't have dental health care, health insurance. I couldn't really afford to go to the dentist, and so we didn't. That factor right there, that there's no publicly available health care and that people have to pay very good money to go to a dentist to get something resolved, means that people don't go to the dentist, even if there is one available, which a lot of times in a lot of communities there's not even a dentist available. And so this whole issue of a lack of a publicly available healthcare system and access to publicly available dentists is a real serious issue here in causing more cavities in Appalachia. A social intervention that teaches granny that sweets cause cavities under these conditions is a joke, because even if granny has this knowledge in her head about these sweets, and I would say most grannies do anyway, she's not conditioned a lot of times to even act on it. My point is that if we don't want a disproportionate number of kids in Appalachia to have cavities, more significant policy changes would be required than simply telling granny sweets cause cavities, like public health care, for example. And that's pretty unlikely, let's be honest.